Cool. Um, and I think some of the recordings get a little bit garbled if so I have the power to mute people, and I really want this to be interactive. I don't just want this to be Steve talking into the screen, but I don't want to compromise the sound quality and the like. And so could I ask you guys to mute yourselves until you want to kind of come online, and then kind of unmute just so the video recording and audio recording, stays in good shape. Um, so
I'm looking to where I mute.
do you
Oh,
see where to mute?
I say mute.
Like, cool. I think you got it. Great.
I
Great.
don't, I don't see where to mute.
Um, I think I can. It's especially hard to see so if you usually something shows up if you hover down at the bottom of the Zoom screen, things begin to show up for you. Um, and then under the audio, there should be like a mute option. But I can
Okay,
also,
I found it. I found it.
you found it, David? Okay,
Yes.
cool, cool. And I can mute people, but if I don't want to mute you if you can't find the unmute button, which would be bad. Do you see it, David? David Gold?
Yeah.
We have a couple of Davids here. And I do want to introduce another colleague that's here, right? Especially and I guess we haven't done a whole lot. It's been kind of it's been a welcome place where people can come and learn and then not be put in the hot seat or something like that. I really want people to share, but also there's kind of two groups of folks that are moving in and out of this space, right? And a large group that I'm so interested in that is get your input are the participants in the study, people that are receiving gloves or are waiting for a glove. But then there are also folks that are kind of back in Espanola that are thinking about, how to take your concerns to heart, right? And how to build a better glove. How to build at two levels, right? How to make the current glove more robust, and then how to make the future glove more responsive to you as the individual as you move through Parkinson's, right? So Minna Santos at the bottom of my screen is her husband was the first patient of ours. She's the one who brought this project to my attention. Um, and and she is super responsible for helping kind of participant intake, right? For kind of getting communication going between people that have asked for a glove, and then getting that information to the glove manufacturers. She's a colleague of mine in Dixon, New Mexico. Chuck Wright is also a colleague of mine in Dixon, New Mexico. Chuck's a retired engineer from Hewlett Packard who's got lots of innovative ideas on how to make the glove better, the current glove more robust, and future gloves a little bit more responsive. And so Chuck and Minna, I want you to meet David Torres. David's the chair of in the math department at my college. Um, and so he teaches machine learning and statistics and calculus and the like. And I'm trying to this project is way too big for a small group. And so the more local folks we can kind of get involved in kind of troubleshooting and app building and advising students in kind of working on quality control, the better. So David Torres, I welcome you. I'm really glad to have you this evening.
Yeah, glad to be here. Thank you for inviting me. It's a great group. So I've been listening to the videos. So yeah.
Cool. Wonderful. So with that, I'd like to steal the screen, right, and just kind of spend a few minutes taking a look at the one paper that I was hoping we could kind of work through, at least work through the highlights this evening, as a future direction for where I'd like to go. And also, I'm really interested in understanding, people's response to some of the claims in the paper. So I'm going to share my screen and bring up the PDF. Cool. Let me just move my pieces around a little bit. And as usual, you guys are going to flag me, right? If I'm speaking too quickly, things you want to see more clearly. So let me try to grow this a little bit more Got too many things. There we go. Is that font big enough for you guys to follow with me? As usual, I've highlighted just a very few number of passages, and and those are really ones that I want us to focus on. So first of all, I mean, just kind of where are we? We're in a journal called Methods X, right? That's a great journal title. Methods X is everyone's, I think, definition of the unknown as the major variable in algebra for ninth graders. So method X is, what are the next level of methods that are out there? Methods for whatever, right? And so here, this is a survey paper on methods for detection and management of freezing of gait in Parkinson's. And and I'm still struggling, you all, right, to find the right level of rigor and mathematical detail and kind of behavioral studies. Um, I want these things to be helpful for us as we kind of get our heads around Parkinson's. And so I'm wide open to just you guys saying, Steve, man, this really rocked my world, or Steve, this is the most boring thing I've ever seen in my life. What the hell are you? Why are you marching us through this? So I'm eager to know how you guys are taking such things. I can share with you I chose this because the literature on freezing of gait is gigantic. So I usually help students enter the literature by looking at a review paper. Um, the trouble with review papers is they are very, very boring. They tell you what they searched for, they tell you what they found. They don't really tell you how to do, right? How to fix freezing of gait. They just show you what's all out there, right? And I thought for our first foray, we'll look at a review paper, and I'm going to try to pick out some hidden gems in the paper. But a review is largely a list, and I think there's nothing more boring than, it's like reading a cookbook that only has recipes, right? And no kind of preamble, no motivation, no explanation for why this dish is what's going to rock your world. Um, and that's kind of a semi-apology for giving you a dry paper. It's meant to be an entree, right, into a deeper study. Um, Another dark thing about review papers is they're reviewing a gigantic literature, so they have many, 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 many references, right? And I'm only gonna show you one or two of those that will follow down one or two rabbit holes depending upon time to get kind of a firmer grip on what they're talking about. So that's my take. I hope you guys are welcome to chime in anytime, with your own kind of views on this paper or the scientific literature. Um, this literature, of course, I mean, it's scientific communication is a strange mode of communication, right? And it is really meant to be a public good, but there are so many people are writing for fellow experts, right? That the prose becomes hard to parse. So that's why I'm kind of highlighting bits that I think are
Hey, quiet, you
the stuff
guys.
that's worth keeping. Yeah. Betsy, did you have something to say?
Sorry.
Okay. No worries.
I'm
No
sorry.
worries.
I didn't know I was unmuted. Sorry about
Gotcha.
that. I'm enjoying the gloves. I think they're amazing. Um, I've had steady progress since I started wearing them. What, about 10 days ago, maybe?
Mm-hmm. Mm-hmm.
And every day there's less tremor. It seems like it lasts longer. And I turned my head around the other day in the car looking, to my blind spot, and I felt like an owl. I could turn my head further than I had in a long time.
Wow, that's wonderful to hear. Wow. The paper we're looking at today is probably a little bit then freezing out gait happens for kind of more advanced Parkinson's patients. And many people hopefully are going to get there at some point, right? And so if we can improve quality of life on the way to freezing of gait or even detect freezing of gait or more or less override freezing of gait, that's something that the glove has the potential to do. And so I did ask people, Betsy, to kind of mute on the way in, just because our video recordings had a little bit of kind of background noise. But I want to hear from everybody. So please unmute at any given time that you want to share or slow down or speed things up. Okay. So
This is Meg Fitzel. I don't
yeah,
know.
Meg.
I had a question about the highlighted. We're looking at this and we're having trouble seeing it. It's very small. I wonder if
Gotcha.
it could be read out loud.
Yeah,
I
yeah,
do read a lot of science. We have around, we know a lot of scientists here, but a lot
yeah.
of
No, that's good. Yeah. So I'd like to
even with
read.
my reading glasses on, I really
Yeah.
can't see it. I can't. But it
Thanks.
could be
Thanks,
read
Meg.
to me. Thank
Yeah.
you.
Yeah. So I'd like to read, because that also will slow me down in an important way, right? Because I get too excited about things and I kind of move through them too quickly.
It's understandable.
So I would like to read them out loud. So let me just start with the first one. The abstract the abstract is very, very punchy. Freezing of gait, FOG, a very interesting acronym, right? FOG. Freezing of gait is one of the most critical debilitating motor symptoms of advanced Parkinson's disease, PD, with a higher rate of occurrence in aged people. And then, so that's just a bald fact, right? Based upon lots and lots of studies. And for me, the most important thing really is this next sentence. So I'll read the next highlighted one. Gait disorder and cardinal features vary from festination, which is involuntary hurrying and walking, to freezing of gait, breakdown of repetitive movement of steps despite the intention to walk in patients. Hence, it's difficult to assess freezing of gait in clinical trials. Therefore, the current research emphasizes wearable sensor-based systems over pharmacology and surgical methods. Okay, and so that's such an important thing for us to understand, right? So freezing of gait it comes upon the patient kind of spontaneously, and it may or may not happen during this short visit to the neurologist. Um, and so you can spend hours there, or maybe days if you check in. But now with the with the advent of wearable sensors that Chuck and I and Min are working on, you guys will be able, right, to record this freezing of gait and other motor symptoms, as they occur in kind of the comfort of your own home. So that's really what this paper is about. And so that the second bullet that I've highlighted is researchers are aiming at the development of wireless, sensor-based assistive devices that can do three possible things: predict the fog episode in a different environment, or acquire the long-term data for real-time analysis, or for queuing the fog patients, right? And so if we have a better understanding of what freezing of gait is, then then we can predict it, we can respond to it. We can respond to it in two ways, right? We can respond to it by actually changing retuning the glove, right? Retuning the glove, meaning a fog episode has occurred. That means the glove is not performing in its optimal way, and so we can begin to retune the glove parameters to respond to fog. But the queuing is also something I want to take you guys there, and I'm not sure if any of you have kind of queuing devices, but we can. It's possible now that if you can detect freezing of gait before it even occurs, and there are some telltale signals. Even your heart rate begins to go up a little bit before a freezing of gait episode, and heart rates are really, really easy to detect. And just sensors we can put on your glove. Can we use that then to give you some visual or auditory or even a physical cue to help keep you moving, right? And so it's a very exciting time for these things. And again, the literature on the bioengineering of these sensors and actuators has been out there. They just have not gotten into the clinic. And the glove is a venue for us to actually embed these new sensors and technologies. Your glove is already wireless, is already talking to an app in principle and in practice in a couple of cases. Okay. And so in some sense, the abstract tells it all. And now in the next 30 minutes or so, I'll unpack a few of the things they're talking about. But and maybe just before we get there, just a couple, just some people, it helps to have, for people that are suffering, I think you have no difficulty understanding that it'd be good to predict your gait freezing before it happens. But there's a gigantic similar literature on wouldn't it be nice if epileptics got a warning of a convulsion happening before their brain shut down, right? So can you predict an epileptic seizure? At the societal level, we're still trying to, okay, we're now pretty good at predicting hurricanes. We suck at predicting tornadoes. We're also pretty bad at predicting earthquakes, right? And again, we could be saving, and these are very similar mathematical technologies for kind of observing what's happening, making indirect measurements, right? We're not observing an earthquake, right? We're not observing a freezing of gait. We're just observing parts of the body. And can we use these signals as telltale signatures of a freeze that's about to happen, and then help the person through the freeze and save them from going down on the ground, right? And similar thing for earthquakes and tornadoes, right? I mean, can we save, villages from devastation of tornadoes and earthquakes? Can we save individuals the devastation of an epileptic seizure? So each one of these projects has like a small Manhattan project going after it, right? So scientists at all levels, engineers through kind of fundamental physicists working on these prediction problems. And fog is in there. And of course, one of the real, the weak point, right, is measurements. We need more data. So let's I'm going to begin to turn the page, right? And as I click, things just, there we go. Cool. So I've highlighted a little bit more, in the introduction. Let me get rid of my commenter, go over to my selector, sorry. There we go. So now I can pan better. And I'm afraid I want to make sure my Zoom box isn't covering too much of this. And I also know, we only meet once a week, so it really is good to repeat some things once in a while. So I talked about kind of the need for better data, right? The need to kind of quantify freezing of gait. And we learned, from a number of folks last time, kind of reiterated the fact that the current rating scales are largely subjective. And for people that are lucky enough to have the same neurologist over the course of their disease, who can make a kind of consistent diagnosis, that's really a good thing. But if I begin reading this, the conventional subjective scale rating is the first clinical is the first clinical test for rating the severity of freezing of gait, but does not give quantitative information, right? And as a scientist or engineer, until you have quantitative information, you really cannot predict what's going to happen next. I mean, it's just, all you can do is say, yeah, I see that happened. And so laboratory-based gait analysis is a standard gait in a standard gait laboratory in a hospital research center where sophisticated instruments are deployed to record the kinematics of human gait. And so that's something, maybe, in 20 years, we're all going to have a video laboratory in our houses, with kind of 3D motion capture of our motion, but we're not there yet, right? And so I'm trying to keep us out of the laboratory and kind of keep you in the comfort of your own home and still gather data. But nonetheless, that laboratory-based gait analysis where we can really kind of key in on 3D movement of so many positions on your body, that's so-called gold standard, right? But again, due to the unpredictable nature of fog episodes, it's highly challenging, lengthy, and costly, right? I mean, so you set up one of these 3D, image captures of your gait, and for some reason, you don't have a single fog episode, you understand what I'm talking about. Hence, it's difficult for day-to-day assessment as well as treatment of freezing of gait. With the development of portable and wireless sensors in the last decades, it became feasible to design a low-cost and highly reliable ambulatory gait analysis system for the detection of freezing of gait and Parkinson's disease. And now a little bit into the science, engineering world. So inertial measurement units are commonly used by many researchers to detect the pre-fog and fog episodes due to its simplicity, small size, and high reliability. And they give us a reference. Other techniques, such as force sensor-based electromyogram or EMG, electroencephalogram, EEG, and skin conductance are also used. And so, again, for folks like this is just, there's a whole menu of different kind of techniques for things that you can measure about the body and send them to the computer sitting in your glove, right? And for your glove to learn about, to log those things, to learn about those things, so you can respond better at the moment, and then maybe your glove can respond better in the future. So I find this a very hopeful paragraph. And I hope to do more than just talk about hope today. I mean, I really want to I want to demonstrate an app that's using these kind of inertial measurement units. And so, yeah, that's a very fancy word for inertial measurement unit. So to measure inertia is to measure acceleration. Every one of your smartphones has an accelerometer. Your smartphones are typically they typically need to know where they are in the world, so that when they feel themselves being dropped, they can shut themselves down, right, before you lose important information. So your cell phone has a built-in inertial measurement unit. And so I'm going to show you an app in a few minutes, where literally you can say start on the app and walk around the room, and it scores your gait, and it detects FOG, it detects freezing of gait. This is a detector right now, but I just want to kind of show you that already this is something that that I and my group can do, and we are busy trying to figure out how to use that to cue the user, that to kind of help them break the freeze, because it's not enough to tell someone not to freeze. So we need some kind of distractor, which I'll show you. About how to break the freeze, and then also just the prevalence of the freeze needs to be able to better inform us about how to tune the glove. So again, I find this a very hopeful paragraph, and for readers that are also equally hopeful, you may want to go down the rabbit hole of following reference 3, reference 6, or reference 7. And as I mentioned last time, I mean, so it's depending upon your access to scientific literature or interlibrary loan. If you have trouble recovering any references from anything here, please reach out to me, and I can help you obtain any scientific publication that you'd like to get your hands on or your eyes on. Okay. Okay. So there's quite a bit more, kind of more background, right? So this is a methods journal for readers that may not be, informed about Parkinson's. So there's a lot of background reading here about Parkinson's, which maybe is things you guys already know about. If not, so there are a couple of new things for me, right? And so I was intrigued by this first thing, Meg, that I'm highlighting. Studies have shown that heart rate increases during pre-freezing of gait and freezing of gait episodes. So, oh my goodness, right? I mean, anytime you discover a signal that's a precursor to something bad about to happen, I mean, this is really, really amazing information. Of course, it differs with every patient, but each of our participants has their own glove, and this ought to be something that we could exploit to be on the lookout for what's about to happen. Okay. And then finally, in this early introduction, they kind of get to the prevalence of freezing of gait. So here's a gigantic study, almost 20 years ago. In 6,620 Parkinson's patients, they found 80% of advanced Parkinson's patients reported freezing episodes. The study reported that around 47% of patients experience fog events regularly, with more likely in men than in women. And so so for me, this is, pardon my French, this is a BFD, right? I mean, so it's anytime is something happening, half the patients are this is happening regularly, right? This is just an invitation for them to fall and to hurt themselves, right? And to lead to further degradation. Okay, so that kind of the final one in their kind of general long introduction, again, for me, is a very hopeful paragraph. There are certain precipitating and ameliorating factors for freezing of gait. The precipitating factors include approaching doorways, dual tasking, distractions, crowded places, and being under time pressure. And if you guys watched the video of Kanwar on the Today Show, or watched the videos that were included in Tass's paper, you saw that that doorways especially seem to be an intimidating place for advanced Parkinson's patients to pass through without freezing, right? So these precipitating factors, right? And so this means what brings on the freezing of gait, really, and then what can moderate or mollify the freezing of gait. So ameliorating factors include emotion, excitement, auditory cueing at the proper place, targets for stepping and climbing stairs. Factors that distract the patient's attention from walking will promote FOG, and factors which focus attention on stepping will reduce it. This is consistent with the cortical takeover of impaired subcortical control of gait. So this takes us back to the previous paper, right, where in Parkinson's, without dopamine in the motor cortex, there are rhythms that are not allowing you to enjoy voluntary movement, right? So impaired subcortical kind of takeover, right? And so one way to recover that is through more dopamine. Another way to recover it we're exploring is through vibration of the fingertips, but also another way is just to distract the patient's attention, and maybe use some other pathways. And so here I've got a comment that says follow the NexStride link, right? And so so NexStride is a recent product on the market that I just, again, I like to step out of these papers once in a while and say, have they, what are they talking about? Have any of these ideas been kind of taken to market? And so let me see if I've got this. Yeah, I think I have it. So I'm not sure how smart it is to play kind of videos through the Zoom, but hopefully this thing will kind of move for you guys in real time. I'm not, before I do that, let me make sure I turn on the sound. So during share, I really need to make sure. You don't exactly need the sound for this, but let me make sure that you've got it. Audio. Yeah, I should have prepared that earlier. So even without sound, you're gonna, in fact, I can practically narrate.
Problems can be frustrating and debilitating, leading to falls and other problems. You may end up feeling stuck, helpless. Reclaim the freedom to walk again with NexStride, the easy-to-use device that attaches to any walker, cane, or walking pole. Walking and balance problems are often due to a disconnect between the brain and the body from conditions like Parkinson's disease or stroke. NexStride reconnects the brain and body. It does so by switching movement from automatic to goal-oriented, which in turn changes the part of the brain that is being used. NexStride uses two types of sensory signals that provide alternative ways for the brain to tell the body to move. The first signal is visual, a green laser line projected onto the
Yeah, so let me pause right there. This is the key thing, right? And so this is a small little projector with a speaker, right? And the projector, it knows, where the hand is, and it draws a green line, roughly say 20 inches out in front, right? And so it gives the walker a target to shoot for. So even when the motor cortex is having trouble, there's a visual cue here that in principle and in practice, right, can kind of interfere with the bad rhythms in motor cortex and realign, motion back to the feet to get up to the green line. So that's a visual cue. In addition, there is a speaker here with a metronome that's playing in audio kind of rhythm, right? And then the rhythm is in a frequency which will ought to be close to a normal gait. And again, you get to adjust this distance, and you get to adjust the frequency of the auditory stimulus to try to keep you in rhythm as you kind of cross the room. And so this thing's on the market. It's NexStride, NexStride. And there are quite a few testimonials to this. It's personalized in the sense that you get to kind of dial in a few things, but it's not connected, of course, to any other kind of stimulus that like the glove that we've been working on. So these are ideas I'm kind of stealing or borrowing that I hope to kind of bring to the glove in the future. So can I ask you guys if yeah. Have you guys seen such technology before? Have you thought about queuing the light to kind of give you a target to step into? Maybe you're early in Alzheimer's and that you're not suffering from these symptoms. So
Down in Tennessee or Rock City boxing, I've seen people with the walkers have a tennis ball hanging down in front.
gotcha. And
And I guess the moving tennis ball helps.
helps.
Folks
Yeah,
not
gives a visual cue on where they need to be next.
Yeah.
Gotcha. Thanks, Ken. Okay.
Steve,
Yeah, Linda.
there's a special walker called U-Step that has a laser pointer that's very similar to the NexStride
Gotcha.
that some friends of mine used and found it to be very helpful.
Cool. Yeah. Thanks, Linda. So this is kind of as part of the queuing strategy, right? I mean, and another kind of another intervention, right, would be if you can detect that, say, fog is about to happen, can you give a small vibration to the heel, right, or a small even shock to the foot, again, just to try to interrupt the person's attention, right, to kind of get them out of the freeze that they're in to take them someplace new. So I don't think that stuff's yet to appear on the market, but there are lots of people experimenting with that. How to give someone just a slight nudge, right, to kind of keep them moving in the right direction.
For myself, these types of things are a result of anxiety, and anxiety exaggerated in my body, and it can cause me to freeze. And so, one thing is knowing that it's mishandled anxiety. When it happens, I can do something. I can just breathe slowly, or something like that. But the thing is, I think you're talking about like the heart speeding up. I would think the heart speeds up because of anxiety. And,
Yeah.
By other things that are related to anxiety, that other signals that you could, or other physical cues that you could detect.
Right. Yeah, that's an important statement, David. Yeah, because just because something happens doesn't mean it's directly tied to freezing of gait, right? And so anxiety, emotion, attention, those are all kind of put together, right? And we don't want to be setting off a fog alarm, every time there's any anxiety, right? We just want to we want to help people move at the right time. So that heart rate signature is a little bit too vague, I would say. Yeah.
Well, what I was saying is that the freezing of gait, I think, is related to the anxiety.
Yeah.
It's like if I walk into a corner, I'll get anxious and then I'll freeze. And so I think you can use the anxiety signal, or it'd be worth trying.
Yeah, 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 yeah. I'm saying we saw this kind of there's so many possible sensors out there, right? So to do them in conjunction, right? So just heartbeat, or skin resistance, right? Or perspiration. Those are all things that are now easy to detect.
I tend to lose my balance. I feel like I'm being pushed backwards, and that's when I would. But I have had some freezing of gait, but very little. It just the whole thing seems to be woven together. That for me, and I don't know. So, but if I can distract myself in the middle of it, that works for me.
Gotcha.
Really,
Uh-huh.
have some way of distracting myself. Then I can catch myself from falling.
Yeah. Do you concur with David's statement? You know that is there a feeling of anxiety too as you're feeling being pushed back?
When it happens, yes, I do feel anxious. I feel a little bit helpless. It feels an invisible force is pushing me. It feels odd.
Yeah. Gotcha. Thanks, Meg. So I'd like to tuck back in the paper, and oftentimes I largely highlight things that are in the introduction that really state kind of the punchlines of the paper, but then also I want to look at a couple of figures in the paper to really give us some, you know, some to help us kind of quantify what's really going on. So with your permission, I'm gonna steal your screen again. Let's take us back to the paper. So there's the first figure is just, how do they conduct their study? We have to trust that they're decent scientists. They got this stuff published, yada, yada, yada. This is a lovely picture of kind of what the gait looks like. And again, this is not rocket science to any of us. We've all been walking for years. And the key thing, is kind of how to quantify. And again, I don't really like the words normal or abnormal. You have a gait, I have a gait. In fact, some people even there's your gait is as important as your looks and as your sound, right? It's just one signature of who you are as an individual. And so can we actually monitor the gait and learn from the gait what's functioning or not in motor cortex? And so we'll look at some. This is this kind of a cartoon of the gait, but we'll look at what happens when we put force sensors inside your shoes. So what kind of force are you applying, right? And when we see the force that you're applying at different times during a straight walk, can begin then to diagnose or to score your gait, right? And to score your gait over time is to understand, is it deteriorating? Are there periods of freezing, or are there not? And how can we minimize the number of episodes of freezing of gait? Okay, and so now we're qualitative methods. Yeah, so this I kind of like this picture. I think maybe this is in some sense the best picture for a review study, right? Because they're kind of breaking it down to how really do we assess freezing of gait. And by we, they mean, the scientific community. So there are qualitative methods. And last time we looked really, really briefly at the Unified Parkinson's Disease Rating Scale. And Conor spoke kind of convincingly of this. He was up in the 60s. And over the course of his treatment, he's now down into the 10s, right? Which again, I think is just an amazing story. But there are other qualitative scales. So there's a modified Hone-Yar scale. There's questionnaires, yada yada yada. And so I don't want to trivialize the importance of these things. They need to be there. But as an engineer, I don't really know how to help people based upon these scores. I know how to help people if I got information about the force that they're applying in their feet. If I really have a 3D motion capture, of kind of each of their joints. Um, or if I'm able to measure muscle contractions in kind of key muscles during an experiment that we design. So our next section, our next talk will be a paper about electromyography, right? It'll be a paper about measuring muscle contractions. For me, that's just amazing data. And we're now on the cusp of having sensors that are in the $50 range, that I can send out to you and that you could wear and go through the protocol of kind of contracting certain muscles during a certain task. And we can kind of diagnose Parkinson's, which means diagnose kind of the efficacy of the glove. Is it making things better or worse? So that's coming next time. The force plate, we don't, these are things that you have to be in the lab to do, but we're soon going to be able to do that at home. But also, these are also things you can do at home, with these wearable sensors. It's not so easy to do the EEG, the EEG cap at home. It is pretty easy to do force sensitive things at home, and for sure we can do inertial measurements like the accelerometer in your phone. Okay? And so I think I got a little bit of a comment there. Yeah. So I guess just to show you some pictures, right? So there's a lot of references to data that's been taken by various groups that are that are capturing motion, that are capturing muscle contractions, or that are capturing force. So I just want to show you a little snippet of data, right, that I downloaded from one of these papers, and I plotted it in Python for David and Chuck. And so here's a data set from PhysioNet, and it's a Gait PDB, right? So a Gait database, and this we're looking at about 3 seconds of data from a force sensor in red under the right foot and a force sensor in blue, under the left foot. And so there was a cartoon, right, of someone walking across the room, but this is how it gets quantified. And so I think we can kind of see here, hopefully, friends, that left foot went first, and then the right foot, and then the left foot, and then the right foot, and then the left foot. And we can also even see here kind of the frequency of the gait, right? And so, how far is it from, say, this peak to that peak, right? It's about 1.25 seconds. How far is it from, say, this peak to that peak? About 1.25 seconds. Right? If you wish, maybe just down to, you can round that down to 1 second if you wish, right? And so engineers and clinicians would say this person is walking at about 1 hertz, about 1 cycle per second, right? 1 step per second. And this is part of a normal gait. This is not a chunk of fog, which I could definitely bring up for you, right? This is a normal gait. And so someone's walking in kind of the 1 hertz regime.
It's not symmetric with the left and the right. They're very different. I don't know if you want to carry it out the more cycles, but they're very different. I don't know if the person's like right-handed or left.
Yeah.
But they're different pressures that you see.
That's a good point, David. Yeah. So this is just a tiny piece of the data. They've got 8 sensors in the bottom of your feet, and so I'm not even sure about kind of the placement, right, of these individual sensors. And so I kind of just wanted to glom on to kind of the rough things that are the same, so kind of peak and then a peak and then a peak. But for sure there are some details to think about. But also the foot is a very, kind of it's not an easy thing to attach sensors to, right? It's not, our feet are far from flat, hopefully. But yeah, the variability in the right and left is something I have not explored at all in this data set. It's a huge data set. And each one of these goes on for about 120 seconds, right? 2 minutes of data they're showing you. So I'm kind of zooming in just to show you, just to try to glom on to the fact that a normal gait is in basically the 1 hertz 1 hertz place, so kind of 1 step per second, right? And with that, we can kind of keep on moving through the, so that was just a note, right? To look at the foot view data. So this is their kind of the rough picture of like a lot of the technology that they would like to be applying to these folks, right? So these electroencephalogram caps, this is like the cap that Kanwar wore in Tass's lab to really see the brain activity and motor cortex. These are in the tens of thousands of dollars and require a lot of offline processing. That's not something I see happening in the near term. In the not so far term, there are folks that are trying to replace this EEG cap with an earplug, right? So there are I mean, the hard thing about measuring brain activity is your skull, right? But there are a few holes in your skull, and your ears are two of those holes. So there are now EEG kits, right, that can fit in as an earbud and have pretty good discrimination of what's really going on inside the brain. So, but again, that's not going to happen in the next year for us. That's really high tech future business, but it's happening. So what we do have, is kind of something you can wear on your belt or put in your pocket, which has an accelerometer. We can also measure accelerometers. We can put accelerometers on different places on your body, and we can also put electromyograms. So we can be measuring electrical properties of muscle contraction in various places. Your glove is already there, with a wireless sensing device. And the data I showed you and the data that Dave was talking about, basically on the foot force, is we can put a force sensor at the bottom of your foot inside your shoe. And as these little wires here bend, they change electricity out here. So we know how to change kind of a bending force here into something we can measure with a computer. And so that leads to kind of a table, which again I find is very hopeful. So this kind of ambulatory gait analysis. So these are things that I believe are around the corner for us. And so the advantage of this technique is that it's portable and lightweight and low cost, suitable for indoor and outdoor analysis, gait analysis over a more extended period. You do not have to come into our glove workshop. You don't have to come in to see the neurologist. And again, I try to say every time, all of these things should be done in consultation with your neurologist, of course. It can provide real-time assistance for fog patients, and it's suitable for day-to-day basis, right? So it's not kind of a one-time deal. There are certain limitations, that we need to kind of to come to grips with. I find all of these highly doable, right? In fact, I don't see requiring calibration for a PD patient as a limitation. I see it as an advantage, right? I see this as personalized medicine, right? I don't see this as a one-size-fits-all technology. Gait analysis we will learn the gait of the person who's wearing the glove, and we will respond accordingly and not treat them as some average among a large cross-section of Parkinson's patients. The highly accurate, that's a matter of degree, right? We need to build a sensor accurate enough to quantitatively ascertain the level of fog if we're to try to use that information to improve the glove. Okay. So I think one of the final places I have, and I know I see we're already 7:55, is that here they're trying to get to really how do they quantify fog? And for me, the most important statement, Meg, and again, this is for people that want to go down any kind of scientific rabbit hole, but this is a huge rabbit hole in science. The Fourier Transform is responsible for so much of the modern world, so much of our technology. So in some papers, performance metrics are extracted using the Fourier Transform. And so I did put kind of reference 32 also on our journal page. And so I want to just take you there really quickly. And I, apologize if that's just I want to share with you some level of quantification, right? And so this is reference 32, which is again hanging from our journal page for today's talk. And also to give you some indication, these ideas have been around for a long time. And again, I think we're all frustrated with the kind of the pace at which science gets translated out of the laboratory, and into the market. So March of 2010, this is largely a German paper. They've got kind of a wearable computer on their back belt. Our technology can make this, this is all the technology is sitting in your glove already. But they're watching gait, right, based upon some sensors on the leg, right? So, and again, the sensor could just be the cell phone in your pocket. And what I want to show you is that when a person is walking, remember I said that you kind of walk at around 1 hertz. And so let me try to make this bigger, because this really is in some sense the punchline for the app that's available for you guys. So when you're walking, most of the signal is up here in kind of the 1 hertz range. This is hertz, which is in cycles per second, or in our case, steps per second. Okay. So most of our walking is here. There's a little bit of stuff happening, up in the higher frequencies. So this is what happens when you're walking. When their Parkinson's patients were freezing, then we saw very little stuff happening in the low frequencies, and a lot of stuff happening, in say the 5 to 25 hertz band. So this is the signature of fog, right? And so in the app that's waiting for you guys on the page, I have a gait monitor, right? And so that gait monitor, this is just something you can install on your cell phone. These are kind of the instructions for how to get it. And here's kind of raw data of you moving across the room for just a couple of seconds, and we're plotting acceleration. And then you want to know, well, how many steps per second was this? So this was about 2.8 steps per second. I was moving a little bit quickly. And then it does this in kind of 2-second epochs, and then follows the peak frequency over the course of your walk. If the peak frequency stays fairly level, you have a low score. If the peak frequency is moving around, then there was a period of fog and you get a high score. And so I would love as we go forward, if people wanted to grab this gait monitor, APK file from a repository, I can help people install this on their own phones. And unfortunately, to date, it's only written for Androids. I'm trying to teach myself how to write. I'm trying to find the right people to help me kind of port this over to the iPhone. But so this is the beginning of combining that with the app I showed you last time, right? For how to change the parameters on your glove, motor amplitude, pattern duration, and burst duration. If we can now get this app to talk to that app and retune your glove so that you see fewer episodes of freezing of gait, or whatever signatures we work on in the future. So
Yeah.
This is my preview of things that are currently kind of keeping me up at night about how to use that type of data to improve the wearability of your glove, the efficacy of your glove. Sorry. Hopefully it's already comfortable for folks that have it. But that one size fits all parameter set, can't be the right way to go. And so how do we learn from sensors, either this accelerometer in your cell phone or from wearable sensors that we're about to study in coming weeks? So I just got 8 o'clock. That's all I've got planned for us all this evening. Again, I think it's a pretty dry kind of survey paper, but surveys are meant to open the door, right, to kind of try to get our hands around this gigantic literature. and to see that there are papers from 2010 that have already quantified fog, they already have a freeze index that just needs to be explored. Can that index then be used to cue people that are about to go into a fog episode, or can it be used to improve treatment? And that means either drug treatment or glove treatment or DBS. Any questions or response to the paper? Again, I'm also just interested in kind of I don't want to be putting things in front of you guys that you find useless or frustrating. And again, these papers they're not an assignment. I'm here to kind of build up some ideas for my glove team, and I really, really value input from people that are wearing the gloves or have suffered freezing of gait to try to keep us real.
I was fitted for a neural sleeve on my leg. And all the sensors were analyzed by the gentleman who brought it out, conducting the study. And what it looked like was me, like a skeleton walking along, but you could see every bone moving. And then it was programmed to like cue me to walk more properly, I guess. It was very distracting. It was a strong kind of shock, actually, moving around different parts of my legs.
Wow.
But it was interesting to see how my gait looked. And maybe it's a way to help change gait.
Yeah, yeah. So did the sleeve then, did they have video capture cameras that can then respond to and kind of that followed you?
Yeah. And he showed me how it looked afterwards, and it was like a little skeleton walking along.
Yeah, yeah, yeah.
A shock, one of those shocks would probably have startled me out of a freezing of gait.
Gotcha. Yeah, that's interesting.
I can email you their study flyer.
Good, good. I'd like to see that. Thank you, Betsy. Yeah, yeah, yeah. I'm very interested in that. Any other comments, right? Linda, please.
I'm in a study through the University of Rochester called the Apple Watch PD study. And when it started, I was first at UCSF, and they put sensors on us, and they were tracking our gait and everything. And then after the first year, it became virtual, and they monitor us through different exercises quarterly. So it's all sensor based, but it's through the watch. Nothing like with a glove.
Right.
So I think having something like a glove with sensors would actually add, and also on the feet or whatever, would expand the ability to measure that, because they did that at UCSF with some wires and sensors initially. So I think the technology is there, but it's not available.
Right, right. Yeah. So when you said it was virtual, so did they send you home with sensors, or the sensors are only put on you when you're in the laboratory?
Only in the lab. And then how we monitor it now is we have little exercises that are sent to us every quarter with a special little brain app that they have they give us a phone and a special watch. And on that, they do a lot of testing of cognitive, walking, gait, all of that. And then we meet with a doctor every 6 months who also is monitoring us. What they're really doing is tracking progression.
Yeah.
To see how the symptoms change over time, and looking at, I'm sure in the future, where they could intervene. So I think the whole idea of even having more sensors that people could wear at home, which we don't have, we only have the watch. They're doing this all through an Apple Watch.
Right.
And through these exercises that they have us doing on the phone. That coordinates with the watch.
Yeah, yeah. Yeah.
But you might want to look at their study. It's at University of Rochester Apple PD Watch study.
Okay, gotcha. Yeah, I didn't know that was still going on. I mean, because also Apple also kind of gave out kind of a research kit for how to actually set up studies, on the Apple Watch.
Yeah, it's still going,
Okay.
at least this year. Who knows
Gotcha.
what will happen with the
Gotcha.
funding being cut, but it's good
Yeah.
for another year.
Yeah, so I really do think the glove is a missing piece there, right? Because it's so, I mean, what do you do with all this sensor data, right? I mean, you learn a whole lot about kind of the progression or the regression of the disease, but I think we should be using it. So the so-called kind of closed loop, right? You measure something. So for me, my mantra in teaching students, the mantra of physical computing is you sense, you decide, and you act, right? So we sense what's going on in your muscles. We decide what's the most effective action at the moment, right? Not like 6 months down the road after doing offline analysis of your data, right? We sense real-time information, we decide, and then we act by changing the parameters of the glove to adapt to the changing situation that you're in, as Parkinson's progresses.
Well, even a glove could also be used to take in data, like what you're talking about.
Exactly. Yeah, it already is this wireless computer that can talk to your phone. Yeah, so I'm with you. I'm with you. Yeah.
So maybe some of the researchers, if you approach them, might be interested in that too, just from, tracking data.
Yeah.
Not for treatment.
Good. I'll follow up. Thank you, Linda.
Steve, I wanted to ask you something.
Yeah, Meg.
Regarding the gloves that were sent to me. And I just am so grateful for them. And I just thought, I don't know who can I give support on this monetarily, give some money to someone for something for for the students,
Yeah.
work they're doing.
Gotcha.
I'm so grateful.
Yeah. So maybe we can talk offline, Meg. So I mean, we are trying to. Early on, we had some foundations that were helping us. I didn't want to charge for gloves in the beginning until we had something that was like fairly, dependable. But we're approaching that state now, and we're also low on foundation money. So we're asking people for $125. I've yet to set up a company. I've yet to do kind of any due diligence. I've just been so absorbed in kind of designing this and teaching students. So people have been sending us checks for 125, and kind of Minna and my wife Laura have been kind of handling that side of things, and I'm not sure if you've heard from them. I know Ken was working with the foundation at my college, to see if it was possible to make a donation through them. You know, that's that way you can get, kind of you can probably get something tax deductible and the like, and it's more official. It can maybe help more people eventually.
Okay, great.
I'm
There are different, I live in a community where there's a lot of research being done on different things, some medical, and I live on the Cape in Woods
Yeah.
Hole. And of course, a lot of these things are done with fish and eels and things like that, and sea stars. But I think I was thinking other people in our village would be interested in your work and what's being done.
Yeah, by all means, please share our website with them.
Okay.
Yeah.
Yeah.
We're open to all. We don't have an intake survey. We
Great.
want to help anybody that asks us for help.
Oh, wonderful. Thank you.
Okay. Thank you, Meg.
Hi, Dr. Cox. Would it be possible to share Conwar's contact information? He mentioned last week that if anybody wanted his information, you could help provide.
Yes, Aruna, let me, and rather than doing that here through the chat, let me put that right on the page when Conwar was speaking.
Okay.
I'll put that right on our Journal Club page. Is that okay?
That sounds great. That sounds great.
Good. I will do it. I'll do it this evening. Yeah.
Okay. And also, if you have a moment after the call is done, wanted to just chat with you because I'm based in India and planning to travel to the US and wanted to chat about that.
Okay. Gotcha. Yeah, can do. Yeah, I'll stay on. Anybody else want to? Hello, goodbye, your thoughts?
Thank you, Steve.
Thanks, Minna. Great to see you.
Yeah, good to see you too.
Thanks, Ken.
Thank you so much.
Thank you, Meg. See you, Chuck.
Thank you. Thank you very much.
Thank you, Steve.
Thank you, David.
Thanks, Steve.
Okay.